Welcome back. In this video, we are going to discuss the instruments in surgery, the part 1. This is a very interesting topic. In this video, the layout of discussion will be like we will cover the general points regarding the general surgery instruments. Then we'll try to classify the various general surgical instruments for ease of understanding. And finally, in this video, probably we'll finish it up regarding the forceps, the group of general surgical instruments, forceps, with the help of various images and their uses. So these will be the general points regarding the discussion in this video. This you already know. And let's start with the surgical instruments. Basically, most of the surgical instruments nowadays, they are made up of stainless steel alloys. And there are different grades of this metal. Most commonly used is 304. And why alloys are being used to make surgical instruments? Because they are inert and they allow construction of sharp edges. We can make the edges sharp. Just remember one thing, if these surgical instruments, if they are not being properly used, they can get heated up. These are some disadvantages of these surgical instruments. And these instruments can conduct electricity, so we should be very cautious while using them with electrosurgery instruments, monopolar or bipolar. So they can conduct electricity whenever they are not being used properly. The temperature may be raised again whenever we are not using them properly. Sometimes they can reflect the glare of operation theatre lights that may disturb the concentration of surgeon. So these are the some common disadvantages of using these stainless steel alloys surgical instruments if we are not using it properly. Other problems with these surgical instruments made up of steel alloys regarding the poor resistance, the loss of sharpness of edges may occur while using them, and on repeated use the instruments may suffer wear and tear, so they need to be replaced at periodic interval. In order to increase the durability of these instruments, there is a process known as passivation. And what is passivation? Basically, we are supposed to coat the outer layer of these surgical instruments with a metal oxide. This is being coated over the equipment, and this process is known as passivation. And how it is going to help us? It is making these surgical instruments almost inert to air and water activity, right? So durability can be increased with the help of this process. So how to care for this group of instruments, the surgical instruments? They should be washed thoroughly with the tap water after using them. Suppose we have finished up with some particular surgery and now we must know how to take care of these instruments. First, wash with the tap water, and it is going to remove the gross contamination of blood and other body tissues. Then inspect them. Cross inspection should be done for looking for the damages, if any. Then use the soap or detergent based cleaning to remove the grease and body fluids over the instruments. And if available, then deionized water cleaning should be done for the last round. It should be used. And if we are having a facility of ultrasonic cleaning by cavitation, this is a very good idea and we can use it to remove the adherent tissue fat. So these are the important points regarding the care of surgical instruments. Now after cleaning, suppose cleaning has been done. After cleaning, for next surgery, to be done. For preparation of that, we require sterilization. So after cleaning these points, we are coming to the sterilization process of, at least we must know the various processes. Even if we are not going into the details of these processes, but we must know at least the names of these processes by which we can sterilize the surgical instruments. So first one is autoclave. Then by using orthoparaaldehyde, then by glutaraldehyde, very commonly used. Then for sterilization, the formalin tablets as well as the solution is available. Then ethylene oxide gas chambers. So these are the commonly used methods for sterilizing these surgical instruments. Just to give you an idea regarding how these instruments or they do look like, this is an example of autoclave. You can see the vacuum release valve present here, this steam release valve, and this is the autoclave body, the handles, the autoclave lid, the safety valve is here, and there is pressure gauge for measuring the inside pressure, and there's pressure regulating devices, how to stand. So this is a basic design of any autoclave. Just to give you an idea, suppose if somebody is asking you what is this and you are present in the operation theater and this the sterilization portion of the operation theater, you must be able to identify at least what this machine is, something looking like an autoclave. Yeah, this is how this orthoparaaldehyde is, the orthoparaaldehyde solution. We can use this also for sterilization of surgical instruments. The third option is this glutaraldehyde solution, and then formalin. You must be able to identify at least. Huh? And this is how the ethylene oxide gas sterilization is being done. You can see here the instruments, and this is the chamber for sterilization by ethylene oxide gas. Now, okay, we have cleaned the instruments, then sterilized the instruments, and during this procedure, the storage of instruments is another important topic we must know. And for storage of surgical instruments, just remember DIN tray, wash cart, and mesh trays. These are the things they are being used to store the instruments for cleaning and sterilization with small instruments. And there are a few important points regarding the storage. For example, the larger ones, they should be kept below the smaller instruments, right? Then tips of all instruments aligned in the same direction. Why in the same direction? To avoid damage to the tip, right? And mesh trays, these mesh trays, they are being used for small detachable and reusable parts for cleaning and sterilization purpose. Just to give you an idea, this is a DIN tray. It looks like this one, DIN tray for storage. And this is a wash cart, right? And number of rows are there, and multiple instruments can be stored here. But tips should be aligned in the same direction. And this is a mesh tray, example of a mesh tray for holding the small detachable parts of any surgical instruments. And this way, you can store that. After this, cleaning, sterilization, storage, then suppose we have planned for any elective surgery list. Okay, we are supposed to go for let's say cholecystectomy. Then we can ask for the set. In the operation theater, the instruments, these surgical instruments, they are arranged as a set. If somebody wants to go for exploratory laparotomy, you can ask for a laparotomy set. It will have a fixed decided number of various instruments, the cutting as well as the holding instruments, and so that it is going to help us during the operation for counting purpose and for proper adjustment and arrangement of these instruments. This making the process of making a set depending on the type of procedure, it is very useful. So laparotomy set we can have, for example, a laparoscopic cholecystectomy set we can have, then gastrectomy set we can have, and so on. So in this manner we can arrange the various surgical instruments in our operation theatre. Then another important topic regarding the surgical instrument is how to classify. There are so many surgical instruments. It's very difficult to remember all these different types of surgical instruments without having a particular arrangement or discipline classification. Just by this classification is required to go through these various surgical instruments in a disciplined manner so that we can remember them, right? We can easily identify them later on. So how to classify? There are two methods basically to classify various surgical instruments. The first way is we can divide all these surgical general surgery instruments, or in fact any specialty instruments, into basically three types: the cutting type of instruments, the holding type of instruments, and the miscellaneous group. Basically we can divide it like this: cutting, holding instruments, and miscellaneous group. For example, cutting, the scissors; the holding, various artery forceps, the thumb forceps, and miscellaneous like probe, right? So these are the handle of the scalpel. This will come under miscellaneous group. So this is the first method of classification. A second way, yes, we are having a second way also, and by the second way we can divide it like this. First of all, the handheld general surgery instruments we are going to classify. So first of all, here the forceps, first group, then scissors, second group, then needle holders, the third group, the retractors, the fourth group, the sharps instruments, fifth group, and finally others or miscellaneous. This is the sixth. There are six different types of groups regarding the handheld general surgery instruments. In this video, we are going to follow the second method, the second way. The first method is very easy. You can just by observing the instrument, you can decide whether it is being used for cutting purpose or something else. Now, this is second way we are going to discuss and we are going to follow in this video. So first of all, in this video, now the remaining thing is the forceps part. We are going to discuss the forceps first. Now in this forceps, there are three broad types of instruments in forceps. First one is tissue holding forceps, which are being used for tissue holding, then thumb forceps, and then hemostatic forceps. So out of these three types of forceps, the tissue holding and hemostatic, they behave like class 1 lever, right? Class 1 lever means wherever the instruments where the fulcrum is in the middle of load and effort. So tissue holding and hemostatic forceps, they behave as class 1 lever, whereas this thumb forceps, this group behaves like class 3 lever. Class 3 lever means where the effort is in the middle. You're applying the force in the middle of the instrument, right? This is class 3 lever. So one by one we'll discuss the first of all tissue holding forceps, then followed by thumb forceps, and finally the hemostatic forceps. So tissue holding forceps, this is the most frequently used instrument. Class 1 lever uses these type of instruments. They are used for traction purpose. They can be used for retraction purpose. They can use for holding tissues. And sometimes, yes, dissection can be done with the help of these group of instruments, tissue holding forceps. And what are the examples? Examples are the Coccus forceps, the Lahaye's forceps, the Mixter's forceps, and Rochester pin clamp. These are the some examples of tissue holding forceps behaving like class 1 lever. Just to show you the instrument and example, this is Coccus forceps. Just focus on the tip of this forceps, this instrument. Here you can see the tip. The tips are present and the serrations are there throughout the this probe, this part of the instrument, the distal part, and there is a lock also. There is a lock also. So Coccus forceps, this instrument is being used in gallbladder surgery and some thyroidectomies and sometimes yes hysterectomies also, right? Then this is another is the Lahaye's forceps. Lahaye's forceps. This is again the tip. Just focus on the tip, the long this distal end with serrations, and there is a lock again here, right? Stainless steel. So this group of instrument, the Lahaye's forceps, this is being used for blunt dissection whenever we want to go for blunt dissection. And this is a straight variety of Lahaye's forceps, and there are other variety that is curved variety. And this curved variety of Lahaye's forceps, they are being used for ligation purpose, ligation of vessels and any other tubular structures for passing suture material, right? So Lahaye's forceps for blunt dissection as well as for the curved one was the curved one is being used for ligation of vessels. And this is one of the example of Mixter's forceps, right? You can see here. Just focus on the right angle of this Mixter forceps. The tip is and there's almost right angle with the plane. This is one of the example of Mixter's forceps. And why it is where it is used, this Mixter's forceps? Whenever we want to reach some obscured surgical site, the site that is present in the deep area or a very difficult area. So this type of forceps can be used. The tip is at the right angle. And why we want to go there? Yes, we want to ligate some vessels there, or we want to ligate some tubular structures there. And yes, sometimes in the dissection for dissection purpose, this Mixter's forceps can be used. For example, in cases of Calot's dissection, sometimes this right angle forceps is also used. Globally, it is known as Mixter's forceps. It's always better to use the global terms, right? And finally, in this tissue holding forceps, the Rochester pin clamp is another example. And whenever we want to catch hold the bigger blood vessels, we should use Rochester pin clamp. It's sort of less traumatic, almost atraumatic forceps with a lock. You can see with a lock here, and just focus on this distal end, the straight as well as the curved one, and you can see the serrations, the minor serrations throughout the distal end. This is Rochester pin clamp for clamping the bigger blood vessels. This is the use of this clamp. So that is all in tissue holding forceps behaving like class 1 lever, where fulcrum is in the middle. You can see the fulcrum. This area is acting as fulcrum. Why? What is class 1 lever? Class 1 lever means you are applying the force in this direction, right? Let's focus on this prong. You are applying the force in this direction, then this portion will move in this direction, just opposite. So whenever the direction of load is opposite to the direction of effort, that is an example of class 1 lever, right? Whereas if these directions are in the same, these load and effort directions are in the same, that becomes class 3 lever. So let's come to the thumb forceps. Again, an example of class 3. What are thumb forceps? They aid in dissection and tying sutures when we want to tie sutures by holding tissue and doing retraction using left hand. Usually these thumb forceps we are using in the left hand, and while in the right hand, while doing active dissection or suturing by right hand with the help of a needle holder or some other instruments on the right hand, and thumb forceps in the left hand. These thumb forceps, they're usually having 4 parts. And what are those 4 parts? The tip, the shafts, the handle, and a spring joint at the end. At the end, we are having a spring joint. And in this group of instruments, the tips are designed specifically according to the use of these instruments. And accordingly, the tips can be simple. The tips may be having serrations. The tip can be toothed or pointed. Pointed tips are usually used for fine dissection, right? And Russian tissue forceps is another example. The Russian tissue forceps of this thumb forceps. This is another example of thumb forceps. These instruments, they have a cup and surrounding spike serrations at the distal end, working end, and this is usually used for dissecting biopsy specimen and very commonly used in oral surgery department, dental surgery also, this Russian tissue forceps. And there are a variety of sizes of thumb forceps, and this is going to help us in making the tissues accessible at all depths. Examples of thumb forceps, commonly used examples are the toothed dissecting forceps, the Adson's pickups, D. Becquet forceps, and St. Martin forceps, right? And all these, they behave like class 3 lever. The toothed dissecting forceps is like this one. Just focus on this again, the tip. Here you can see 2:1. One tooth and two tooth here, right? To hold where it is used, this tissue dissecting forceps, to hold tough tissue like fascia, or whenever we are doing the abdominal wall closure. So these toothed dissecting forceps can be used. Here you can see there are 4 parts, the tip, and usually we apply the force here in the middle, and again these prongs, the same, they will come like this, and the fulcrum is at the end. So these are class 3 lever, right? Then Adson's pickups. The Adson's pickup, again a very pointed one, the toothed as well as non-toothed, and these Adson's pickups, they are usually used in everting skin edges while applying staplers, right? While applying staplers, and very frequently used in plastic surgery also, the Adson's pickups. Then D. Becquet's forceps. D. Becquet's forceps. Just focus on the tip. A sort of atraumatic forceps. You can see here, atraumatic. The straight one as well as the slightly angled forceps. These De Becquet's forceps, they are frequently used for vascular surgery, right? The same with the St. Martin forceps. To see the distal end, long and slender, St. Martin forceps. Then St. Martin forceps, these forceps are frequently used in ocular surgery and for holding the flaps of cornea and sclera, right? You can see here inside the knobs are there. You cannot press more than this, right? So St. Martin forceps, ocular surgery. This is an example of Russian tissue forceps. You can see the distal end. Distal end, again, there are the cup-like structure is there with serrations, and this is frequently used for biopsy, taking biopsy. Sometimes in oral surgery to put gauze or packs, very frequently used by dental surgeons, right? Russian tissue forceps. And finally, the third group in forceps category, the hemostatic forceps. As the name suggests, hemostatic forceps means for controlling of bleeding. So uses are for controlling bleeding vessels and for holding tough tissues. Sometimes these forceps can be used, hemostatic forceps. Most of the artery forceps, they come under this group, hemostatic forceps, right? What are the advantages? By using these hemostatic forceps, there is the shaft to working end ratio is high in these group of instruments. High shaft to working end ratio. And how it is going to help? It is going to magnify the force applied at the effort side, the force that will become 3 to 5 times more. And good force we can get from this by using these type of instruments. And again, these are examples of class 1 level. So almost 5 times magnification of force is being done by using these forceps, and that's why they are very frequently used, or that can be used for controlling bleeding. Examples of commonly used hemostatic forceps: mosquito forceps, Robert's artery forceps, the Kelly's forceps, the bulldog clamp, and Satinsky forceps. These are the common example of hemostatic forceps. Very quickly, we'll just have a look. Mosquito forceps, you must have seen these instruments to hold smaller tubular structures. The curved as well as straight variety available, and all these instruments, they're having a lock here. Then Robert's artery forceps. Robert's artery forceps, again for clamping blood vessels, slightly slender, long. The tip is usually atraumatic. These Robert's artery forceps instruments. Then Kelly's forceps. For practical purpose, just remember all the medium and large size artery forceps. They are Kelly's forceps, the straight and curved variety, right? Again, Kelly's forceps, the serrations are there. And then bulldog clamp, this is a vascular clamp, very commonly used in vascular surgery for vascular anastomosis and for controlling bleeding, the bulldog clamp. And finally, this Satinsky forceps, vascular clamp, very commonly used for transient control of blood flow, like to create artificial ischemia while doing any renal surgery. And these instruments can be applied over the renal pedicle. So vascular clamp, just see the tip, the direction of this curve, right? So these are examples of Satinsky forceps. Satinsky's vascular clamp, again having a lock here. So that is all regarding the forceps, the three groups: the tissue holding, the thumb forceps, and the hemostatic forceps, and various examples we have seen, and just few points to remember. And then after that, we'll finish it up this video. The forceps, we are just particular about the forceps. The forceps are usually they are held in such a way that they become extensions of our thumb and index finger. And for this, a pencil grip position provides the widest range of movement, right? Important thing is we should not hold the shank of forceps in palm of our hand. Why? Because this is going to significantly limit its use, and for using these forceps in this position, it requires extreme flexion of wrist, which may be painful, which may be very cumbersome, ergonomically not correct. So this should be avoided. What should be avoided? Holding the shank of forceps in our palm of hand. The better position would be the pencil grip position while using these type of instruments, that is known as forceps, various forceps, right? So that is all in this video. See you in the next part for other instruments. Thank you.